Hi everyone, this video is part 4 of the unit on clinical psychology and AP psychology. And this particular video will cover schizophrenia. And schizophrenia is its own disorder classification, and so this will just focus on schizophrenia and its symptoms. I do want to start by defining a few terms just so that you understand what schizophrenia is and what some of the related disorders are. So to start with, psychosis is a term that you've probably heard of before, or you might have heard the description psychotic or a psychotic disorder. Psychosis is actually a broad term. A psychotic disorder would be any disorder that is related to losing touch with reality. And psychosis is this broad name, and schizophrenia actually falls under it. Schizophrenia is actually the most common form of psychosis. Schizophrenia is actually a disorder that is related to losing touch with reality. So that is important. There are other disorders that fall under the classification of psychosis. Schizophreniform disorder is a psychotic disorder that is very similar and has the same symptoms as schizophrenia, but lasts a shorter duration of time, between 1 and 6 months. There's also a name of brief psychotic disorder, which lasts less than a month. And then there is schizoaffective disorder, when someone has the symptoms of schizophrenia but also a mood disorder. And so those all fall under this broad umbrella term of psychosis. But I want to start with what is schizophrenia, because oftentimes it's misunderstood. Schizophrenia is not having multiple personalities, although a lot of times in everyday language people use it that way. And maybe it comes to the breakdown of the word. The word schizophrenia, if you were to look at the Greek meanings, it means split in mind, but that doesn't mean split personalities. So that's where people get confused. It's actually this splitting from reality and splitting between what is real and what is not real. And so schizophrenia, as a definition, is a disorder characterized by losing touch with reality, but they have to have pretty specific symptoms. And in this video, I will go over some of those symptoms, but there are 5 characteristic symptoms of schizophrenia that I will cover in just a little bit. But before I go there, I want to talk about prevalence. Schizophrenia is really rare. Less than 1% of the US population has schizophrenia. So this is rare. And also it's different in that it has a later onset. So typically the age of onset for men is late adolescence into the 20s. For females, the age of onset tends to be in the 20s and 30s. As far as children, this is very rare, rarely seen in children. It's not that it's not seen in children, but it is incredibly rare to see schizophrenia in those symptoms in children. So just a reminder, this information comes from the DSM-5, which is where the information to classify and define mental illness is. The DSM is just a book that healthcare providers use to identify symptoms and diagnose mental illnesses. To start with, some things that are related to schizophrenia and impact schizophrenia. First, some biological factors. One is dopamine, the neurotransmitter dopamine. Dopamine is believed to be the neurotransmitter that's behind schizophrenia. And the reason for this is there are drugs that block dopamine and then reduce schizophrenic symptoms. And that actually help the schizophrenic symptoms. And so it's believed that there is some relationship between dopamine and schizophrenia. It is also believed that schizophrenia is highly genetic or heritable, meaning that it is something that can be passed down from parents to children, meaning like it can run in the family. There is evidence that shows this, and the evidence is from twin studies. So they study this in twins who are monozygotic and dizygotic, meaning twins who are identical and twins who are fraternal. Twins who are identical, if one twin is diagnosed with schizophrenia, there's between a 30 and 50% chance that the identical twin will also be diagnosed with schizophrenia. With fraternal twins, it's also believed to be heritable. So fraternal twins would be like siblings. They wouldn't share the same extent of genetic makeup, but they would have that genetic similarity since they have the same parents. So fraternal twins develop schizophrenia at about 15%. So it is still likely that siblings, if one sibling develops schizophrenia, then another sibling can, but not as likely as identical twins. So just because it is genetic doesn't mean it will always happen. So for monozygotic twins, it's not 100%. So genetics can't be the only factor, but it does play a role in the development of schizophrenia. Also, there are environmental factors, so non-genetic factors that play a role, family stress, social interactions, infections, viruses at an early age. There are things that can impact schizophrenia, or affect schizophrenia or influence it, but typically it's seen as epigenetic, meaning that that person was likely genetically predisposed to schizophrenia, and then the environmental factor turned on that disorder. So epigenetic is this idea that an environmental trigger can actually trigger something that you were genetically predisposed to. The next factor that's related to schizophrenia is selective attention. And selective attention is the ability to focus in on a stimulus, even when you're bombarded with thousands of other things going on, sights and sounds, that you can focus in on one or a few in your environment and block out the rest. And in schizophrenia, that ability breaks down, and there's a difficulty to have this selective attention. So let's talk through the criteria for diagnosis. In order to be diagnosed with schizophrenia, they must have 2 of the 5 symptoms on the right side of the screen, and they have to at least have 1 of the first 3. So I know that was kind of a lot. So they have to have 2 of the 5, but of those 2, they have to have at least 1 of hallucinations, delusions, or disorganized thinking and speech. And I'll go over those in depth in the coming slides. So the first symptom is hallucinations. Hallucinations are perceiving a sensory experience that wasn't actually there. So they're having this experience, either auditory or visual, that's not actually occurring in their environment. And it can be really vivid and clear to that person, but not actually be existing. And they don't have control over that experience. Auditory hallucinations are typically experienced as voices that are separate from their own thoughts and thinking. Visual hallucinations are when the person they're in normal consciousness. So this isn't dreaming when they're sleeping or being under the influence. This is when they are fully conscious and they are experiencing some kind of visual reality that is not there. The next symptom is delusions. Delusions are beliefs, but they're beliefs that are not true. And it's this symptom in which they have a false belief. It's really hard to change their false belief. Even if you present them with alternative explanations or viewpoints, they typically are not going to believe that. The most common is ideas or beliefs of persecution, that someone or something is meaning to harm you. These could be ideas that someone might consider bizarre or non-bizarre. So bizarre would be believing something that possibly an example would be that aliens have come down and have replaced your organs and then put them in someone else's body, and you've woken up with someone else's organs, but there's no wounds, there's no scars, and so that would be bizarre and implausible. That would be this idea of persecution that has no justified explanation and there's no evidence. Now, some could possibly be plausible, and this would be called non-bizarre, when maybe someone believes this idea of persecution that's not true, but is maybe more plausible, that when police officers are driving by their house, they're actually surveillancing the area and they are watching the person's house and they're keeping tabs on them, and they have this belief that the police officers are watching them. So maybe more plausible, but still untrue. So those are ideas or delusions of persecution. There are ideas and beliefs, false beliefs that are referential, that someone is making gestures or comments, or maybe there's environmental cues that are like personal means of communication to that person. Maybe they see the weatherman waving his hand a certain way and then perceive that as a cue to them, this referential cue. Other delusions are grandiose, meaning that they believe they have this wealth or power or status or authority, maybe even a supernatural power that they do not have, and it is not true. A nihilistic delusion would be a belief that some catastrophe is coming and it's looming and it will occur. A somatic delusion would be that they have untrue belief about something inside of their body, something that is going on. So a delusion is a false belief that you cannot change their mind about. The third symptom is disorganized thinking, and disorganized thinking is kind of hard to determine. It's hard to see someone's thought processes or understand their thought processes, and so the way that this is inferred is through the person's speech. And oftentimes with this symptom, their speech is very disorganized, and so it's believed that that derives from their thinking and their thought processes. And so some examples of this: the person might make loose connections in their conversation. They might move from one topic to another topic. Their responses might not make sense with the conversation, or they might not answer the question. They might be talking about something completely unrelated to the conversation. So another is word salad, and word salad is a more severe form of disorganized thinking and speech, in which the person's speech is completely jumbled and their speech comes out jumbled. So their words maybe string together in a sentence but don't fit together or make sense or make a coherent thought. So the disorganized thinking is paired with the disorganized speech, in that their speech might come out sounding very jumbled. The fourth symptom is abnormal motor behavior, and this is really wide-ranging. So the DSM says it could be anything from behaviors that are childlike silliness to unpredictable agitation. Some of these things are from very rigid behaviors and very stiff motor movements to very flexible motor movements. It's very wide-ranging. A term that is associated with the abnormal behavior movements in schizophrenia is called catatonia, or catatonic behaviors. And these are the behaviors that are very characteristic of schizophrenia, in which there's some kind of, their movement is not responsive to the environment. So they are not reacting in the way that someone else might react. Their motor movements, they might be really spontaneous and active, or they might have odd motions. They might not respond. They might have motions that don't seem to, that a posture that goes against gravity. They might do things that mimic someone else. And so catatonic behavior, just like it says on the other side, is also very wide-ranging, from very rigid and stiff to even very waxy and flexible motions. But it would appear to someone watching to be very abnormal motor movements. The fifth symptom is negative symptoms. Negative symptoms are when a behavior that should occur is not occurring, so it's missing. So some of these behaviors are flat affect. Flat affect is when a person should be showing some kind of emotional expression and are not, so they are expressionless. Avolition is the disinterest in not engaging in activities that one would do in their everyday life, like intentional activities, work, school, just home routines, hygiene routines, things that one would do just in everyday life. So the difference between positive and negative symptoms are: positive symptoms are when an inappropriate behavior is occurring. A negative symptom is when an appropriate behavior is not occurring. Schizophrenia is on a spectrum, so it can be more severe to less severe. Chronic schizophrenia has a gradual onset and tends to be more severe. It is unlikely to have a full recovery. Acute schizophrenia is often triggered by something in the environment and is very responsive to treatment, and recovery is more likely. So, in conclusion, schizophrenia is a separation from reality, and one must have two of the five symptoms.